All right, and we're gonna get started. Good morning, good afternoon, good evening, everyone. So today we have an exceptional GFAN call, exceptional because obviously, as usual, we have exceptional guests and speakers, but also because it's usually a week off. But our colleagues at the Global Fund Secretariat have accepted to share with us some of a bit of a briefing on the upcoming results report. And so we decided to have this special call to give them a chance to give us that brief, to prepare our communications for the actual launch on the 18th, and more generally to sort of get a bit of some information to carry back with us for busy week of advocacy during the UN General Assembly. So that's the agenda for the call, and after that we'll have a short presentation on an upcoming campaign that we'll be launching, that we're calling 1 Year Later Thank You, which is a campaign of gratitude towards donors. But I'll give everyone more details after the initial presentation by our colleagues from the Secretariat. So without further ado, I want to give the floor to Ernest for his presentation. Let me just stop sharing my screen. There we are. Ernest, the floor is yours.
Thank you, everyone. I'm going to share my screen. In a minute, you'll tell me if you can see that. Can you see that?
Yes, we can.
Very good. First of all, I want to thank all of you for making time to be here to of course, listen to me and listen to my friends, my colleagues at the Global Fund Secretariat, share this report. This is our 2023 results report. I say our, not the Global Fund. This is our partnerships report, which is why I should mention that, by the way, you are the first group we are sharing this report with. Not even the staff in the Secretariat have seen the report. Of course, we'll share with them this week, but we found this time would be a good one to share with you. All that to say that we really value, this partnership, but also that we want you to be well prepared for amplification, for sharing, when that time comes, which is why we are sharing with you early. The next point to make, of course, is that this is embargoed until Monday when we officially release the report. So please do not share until then. What I'm going to do to help you prepare for the kind of messages you're putting together is after this, I'm going to share the slides, but I'm also going to share the key messages that will accompany this report. And basically, that is all the highlights across the report, across all the chapters. The report is a huge report, as you know. It's usually, this one is 112 pages. So there's quite a bit to go through. We spent quite a bit of our summer working on that. Now, the other thing I wanted to mention is on Monday, there are a few other items that I'm going to add to, or we're going to share. Basically, that is the full report. That is also at a glance. Basically, that is usually a 2-pager of the report. The report boiled down to a 2-pager. And then there will be a social media toolkit that you can use for your social media. Those will come to you very early Monday morning, and I'll coordinate with Pauline. By the way, I want to, before I even start talking about the report itself, thank Pauline for being such a passionate advocate for us to share the report early, and I really appreciate that. So on to the report itself. That's a beautiful image from Mozambique, where we went a few months ago. We had a trip with Peter. It made our cover story. These are women who are fighting malaria just after the cyclone, and we arrived there and found them in a working in very difficult circumstances, in a flooded area where we are beginning to see, malaria sort of surging back because of effects of climate change and cyclones that are hitting countries like Mozambique. So these women go around doing indoor residue spraying, and passionate women who are leading the fight against malaria in the country. So they made the cover of our report. Now, these are the chapters in the report. I'll have a bit of the headline messages, the key results, of course, HIV, TB, malaria, RSSH, COVID, colliding crisis, and talk about a little bit about investing. Now, the first thing to say is that this has been a record-breaking year for the Global Fund. We've achieved, our programmatic results have been remarkable in many ways. We have achieved numbers that we haven't achieved even before COVID. And three numbers to highlight here: 24.5 million lives. 24.5 million people on ARVs. I want to remind people that that is a cumulative number. It's not an annual number. 6.7 million people treated for TB. That number also, we usually put a caveat that is people treated, and in some cases, there can be one person treated twice. So it's good to know that that is not an additional of, more people, more 6.7 million people. In some cases, it might be that one person has been treated twice. But of course, for mosquito nets distributed, as you can see, that is 220 million mosquito nets distributed in 2022. And that's the big number. We have saved, as a partnership, 59 million lives as of 2022, the end of 2022. It's good to mention that this is not an additional 9 million because there has been a bit of recalibration. As you know, with this report, we usually report the latest available. We use the latest available information to, of course, report, do this report. I know the last report we reported that we had 50 million lives saved. We have done a bit of recalculation. In fact, there were more than 50, I think about 52 million last year. And then the growth to now to 59 million lives. And as Peter's quote there says or captures, these are people, these are parents, children, neighbors. It's good to always have that in mind, because these numbers sometimes can be too big and, perhaps a little, they can almost, somebody can be desensitized to these numbers. But it's good to remember that these are people, these are communities that we serve. And as you look at the big report next week, you will see that across the report, there will be many photos, but also many case studies of people that have been, have been impacted by the work that we do. For example, Shani, this woman called Shani from Tanzania that Peter met with last, I think 2 years ago when we were there, a woman who has been on ARVs for more than 20 years. Now, very quickly, key results. I'll touch just a few things, a few more key results beyond what I mentioned. Basically, 59 million lives saved. It's been a record-breaking year, as I mentioned. We put more people on treatment for HIV than ever before. Treated people with TB, more people with TB than ever before, and distributed more mosquito nets than ever before. Despite all that progress, as you will notice, this report comes at the midpoint. We are at halftime when it comes to the SDGs. And in this report, we wanted to recognize that despite the progress we have made in the last 3 years, post-COVID recoveries, we are still off the trajectory required to achieve the Sustainable Development Goals. This year at the UNGA, people are going to be assessing where we are, and we wanted this report to recognize that despite the progress we've made recently, we are still off the trajectory needed to end these diseases. A few other things that I needed to mention, we need to mention, or that we have, taken account of in this report, that some of the things that are, or some of the factors that are making us get off the trajectory, besides COVID, interconnected and colliding crises, climate change, conflict, deaths. You of course know erosion of human rights, and of course the big one is deepening inequities within and between countries. It's not enough to, of course, talk about problems. The Global Fund is uniquely positioned to tackle these challenges. And we are, in this report, making the case for, of course, more innovations, accelerating innovation, but also investing more to end the stark inequalities or iniquities that continue to fuel these diseases. Again, a few numbers to highlight, and I'll be touching on these across the 3 diseases as we go. You've seen some of these, so I'll touch on some of them that you haven't seen. For HIV, for instance, in 2022, 710 mothers living with HIV received PMTCT. For TB, 1.5 million people exposed to TB received prevention therapy. And for malaria, 165 malaria cases treated in 2022. Let's dive in a little bit into the HIV chapter. And the first slide I want to share is this one. With our programmatic results, and I should have mentioned that there are 2 types of results that we share in this report. Programmatic results, these are results reported through the Global Fund channels from countries where we invest. Programmatic results, like people treated, prevention services offered in that year. But of course, there are the global numbers that come from WHO. Basically, the difference is WHO, of course, reports even the countries where the Global Fund doesn't invest. And this report sort of highlights the progress, the state of the fight against the 3 diseases, and looks at those 2 numbers. The malaria and TB numbers are still, for the global numbers, are still the 2021 numbers. I needed to mention that. Basically because the global malaria report, the World Malaria Report, and the Global TB Report are going to be released later this quarter. The HIV report, of course, is out. UNAIDS reports its data in June, and we have included that. Now, diving deeper into HIV, when we talk about progress post-COVID, we can use many indicators. We can use many numbers, but this is one that we chose to use: HIV tests taken by priority and key populations, which is, of course, a really important way to control HIV. And you can see on that graphic where we were 2019, and then COVID hit, and there was a slight drop. As you may remember, HIV was not hit as hard as the other 2 diseases, but there was a slight drop nevertheless in 2020. And now we are seeing that recovery in 2021 and a notable acceleration in 2022. Now, what are the main challenges we still face when it comes to HIV? Despite that progress, recent progress, post-COVID progress, what are the challenges? Of course, HIV, COVID still affected HIV prevention services, and those, of course, we are recovering from, but HIV infections still remain very high, and we'll talk about that later. Now, at the end of 2022, we still hadn't hit the UNH target 90-90-90 across board. We are still far behind, which of course tells you there's still a lot of work to be done. There are still 9.2 million people who are not accessing HIV treatment, and 1.3 million people were newly infected with the virus in 2022. So there's still a lot of work to be done. And as you can see there, for HIV, I wanted to share this graphic very briefly. This is the progress towards the 95-95-95 for 2025. And you can see where we are. Basically, people living with HIV who know their status, we are at 86. People living with HIV receiving ARVs, we are at 78. People living with HIV with suppressed viral loads, at 72. There's still a lot of work to be done, but if you compare the three diseases, of course, there is a lot of progress when it comes to HIV. We use this slide to show the difference that the Global Fund partnerships investments have made in the fight against diseases. And you'll see basically trends in AIDS-related deaths. The text there actually says, if there had been no prevention or ARVs, basically the disease, the change when it comes to trends in AIDS-related deaths, those would have grown by 169. But what we see now with the investments by our partnership is that we've had a 72% drop in deaths related to AIDS-related deaths. Trends in new infections, again, if the Global Fund was not there, if this partnership was not there, there would have been a growth or a rise in infections, 125%. But now what we are seeing is a drop of 61%. These are, of course, modeling numbers that we have been using over the last many years to show the progress that we are making against these diseases. We, of course, wanted to make sure that we have a graphic and we also have a chapter or an element of this report that recognizes that we still have work to do to hit the global targets. HIV is off track, but compared to the other diseases, as you see, it's actually doing pretty well, but it's still off track. So as you see, the progress towards the UNH target for deaths, AIDS-related deaths, and then the other one is for HIV infections. And basically the thing to note there is the red line, continuous red line, that's a historical trend. That's the path we've been on. And then if we continue on that path, you can see where we'll go. We'll miss the targets. If we are to accelerate, we need to be on the green path. And the same applies for HIV infections. Now, a few things to mention. One of the areas, if we are to recover and to get back on track, HIV prevention is a key one. And the Global Fund is, of course, accelerating investments in these areas, HIV, and areas like innovative areas like HIV self-tests. You can see the numbers. Of course, there are a lot of innovations happening in condom programs and PrEP, and a continuation of innovations. Basically, for us to get back on track, there are two things that this report says we have to do: innovations, but also investments in equity. All those areas, especially human rights for HIV, we need to accelerate progress in those areas. So innovation in HIV treatment, to mention a few. So for treatment for children, the new formulations, and the Global Fund is accelerating investment in those areas. HIV prevention, to mention two, the Depiravine, I can never say that word correctly, vaginal ring, and of course, long-acting PrEP are some of the, PrEP and long-acting PrEP are some of the it's in itself a PrEP. But anyway, these are some of the areas that we need to accelerate. Now, let's go on to TB, because I know we don't have much time. And in terms of post-COVID recovery, TB was the response that was hardest hit by COVID. You'll see in that graphic that people treated with TB dropped from 5.8 million people to 4.7 million people when COVID happened, in 2020. And then, of course, with all the interventions, we began to see recoveries in 2021. And then, of course, that has accelerated further, and we have a record-breaking year with 6.6 million people treated for TB in 2022. Now, but TB remains a big challenge. That first line there, TB kills one person every 20 seconds. It's new language we are using in this report. 20.6 million people fell ill with TB in 2021. Again, remember I mentioned that for the global numbers, for the WHO issued numbers, we are still on 2021, where we are reporting Global Fund programmatic results. That's where we have the 2022 results. But in 2021, more than 10 million people fell ill with TB. And of course, just to mention very briefly, 1 in 3 people who fell ill with drug-resistant TB were accurately diagnosed and enrolled on treatment. But what does that tell you? 2 out of those were not diagnosed and were not put on treatment. So there's still quite a bit of work to be done. So we are still off track to meet the SDG target to end TB by 2030. The key thing will be finding everyone with TB and drug-resistant TB and ensuring that they are treated, they are tested and treated. But having said all that, I still wanted to mention that TB, if you have one message to say about the work that has been done in the last year about TB and progress, is how TB programs registered strong recoveries from the impact of COVID-19. It was massive. And the TB story in this report is, despite the fact that we are off track, it's still a very positive story. So that's an important story to tell. And in countries, and there will be many country examples, countries like India, the Philippines, Nigeria, we saw a lot of progress in recoveries from COVID-19 impact from COVID-19. Again, these numbers, as I explained, without the Global Fund, TB deaths, Global Fund partnership investment, TB deaths would have increased by 143. Right now, we see a reduction of 16% since 2022. And you can see the trends when it comes to TB cases. Now, this is a big one. This is the trajectory we are on when it comes to TB. we are way off track. And if we continue on this path, we are not going to hit the target of ending TB by 2030, the WHO target. You can see that is for TB deaths, and that is for TB incidence rate. If you compare this with HIV, you'll see this one is really worrying. You can see the gap. So again, the continuous blue line is where we are. If we continue on that trajectory, you'll see that broken line. That's where we're going to go. We need to be on the green path. And same for TB incidence rates. So this report is a call to action for our partnership to really accelerate progress in this area. Again, innovation is going to be key. And the Global Fund is investing a lot in all these new, innovative, but also not just new. There are innovative ideas, innovative programs that we've been investing in, and also new ones. For instance, 6-month oral, all oral injection-free treatment regimen for drug-resistant TB. That's going to be a big one, and the Global Fund is investing in that. TB prevention or preventive therapy, the short course TB prevention therapy, called 3HP. These kind of innovations, and of course you can see the others, are going to be very key if we are to get back on track. Of course, beyond innovations, equity is still a big factor when it comes to TB. We know that TB, perhaps more than most other diseases, really affects some of the most disadvantaged communities. Let's move on to malaria because I know we are running out of time. Again, you can see progress, post-COVID recoveries for malaria, suspected malaria cases that received a parasitological test. Again, you'll see a slight drop. In fact, malaria again was not as affected as much when COVID happened. But what we have seen is that we have accelerated even more post-COVID. And that graph is very clear there. I want to rush through this because we don't have enough time. I know we'll have time for questions. Malaria, of course, remains a big problem. There is of course, is a big problem for children under 5. Malaria kills a child almost every minute. They are still, it still kills 600,000 people. 247 million cases of malaria in 2021. We need to accelerate the deployment of innovative tools if we are going to have a chance against this disease. Again, this is what happened across our programs. Just to highlight I think the one that I should highlight there is the prevention medication for pregnant women, 14.6 million, and SMC. And I want to talk a little bit about SMC. I want to jump these graphs. Again, it's the same logic. But one key thing here to highlight is you'll see across these counterfactual graphs for HIV, for TB, for those two, there were reductions since 2002. Basically, we would say since the Global Fund came, if there had been, with the Global Fund investments, a 27% reduction in malaria deaths. If we had not been there as a partnership, there would have been a rise of 91% in malaria deaths. But I wanted to highlight the malaria cases because actually if you note there, since 2002, there has been a growth of malaria cases by 1%. So malaria cases have actually increased in that time, even as deaths have not increased. Of course, all the factors we are talking about, including climate change, but many other factors that we can dwell on later. But anyway, the point to make here is that that's an outlier as opposed to the others. Malaria cases have been increasing since 2002. Again, an important graphic here. This is what is happening when it comes to the trajectory towards the SDGs for malaria. Very similar to TB. We are way off the trajectory. There's need for a lot of work to be done for us to accelerate that progress. Again, innovations and equity. To just mention two innovations, we are very, very keen to, of course, invest in the new nets. In particular, I wanted to highlight the dual active ingredient nets. They hold a significantly higher potential to reduce malaria cases and deaths. And the Global Fund is supporting 13 countries to access over 39 million of these types of nets. Basically very innovative in high burden areas. If you take this net, there's evidence that there's a significant reduction in malaria cases once you deploy this mosquito net. RSSH, very quickly, this is one of our weakest parts of this report. We still have not been able to report very tangible numbers when it comes to RSSH. Basically because it's hard to assess, it's hard to measure what impact. For instance, when you invest in labs, when you invest in health management information systems, what that achieves. So basically, what we do with this report for RSSH, but it's going to change slightly in the next years because we are beginning to build measures to measure the progress there. We basically tell you about the numbers and how much we are investing in these areas. Over 2021 to 2023, we are investing more than $1.5 billion a year in formal and community health systems. And basically, that acceleration is because of reinvestments, reprogramming of the investments that have been used for the COVID response. Essentially, we are investing up to $2.2 billion from COVID money to accelerate progress and investments in RSSH. Labs is a big one, and you'll see that in a graphic coming up in a minute. Investing more than $1 billion.
Yeah. We lost you there for a second. Somewhere.
Sorry. Am I back? Thank you. Sorry, I was saying, I don't know at what point you lost me, but basically, I guess to say the reinvestments, the key point there is to note the reinvestments we are making from C19RM into health systems, basically finding ways to rapidly accelerate our progress or investments in RSSH. In areas like labs, and I'll share a graphic that will show how that has changed with this new C19RM investment. This, of course, involves not just infrastructure, it's investing in community-led and community-based responses. And this is a big area that the Global Fund is focused on. You can see the number there over the 21-23 period, $281 million US dollars to strengthen community health systems. Same applies to community health workers, a key statistic there to mention, in the countries where we support, there are at least 2 million community health workers that are leading programs in the fight against the diseases. A key one to mention here under RSSH is the next gen market shaping framework. You'll be hearing a lot about this. It's about ensuring equitable access to health products. And the key things we are doing there is reduce barriers to health product availability, improve responsiveness and timeliness of health product service delivery or service and delivery, and promote the overall resilience and sustainability of supply chains. The whole idea there is to make sure, or to try to strive to see that health products reach the people who need them the most at the quickest time possible, and in the right condition. An interesting statistic here to mention: we are investing a lot in digital health systems. We have a number that I want to highlight here. We've been able to actually, for the first time, calculate our investments in digital health or basically, sorry, let me go back. Oops. Digital health systems. And basically it's 150 million every year. So over a 3-year period, we are talking about 450 million. Just to mention that one of the key concerns under this area is human rights and the erosion of human rights. We, of course, anti-LGBTQI laws is a big concern. And what the Global Fund is doing, and you should look out for this, there's a big investment in our Breaking Barriers initiative across 20 countries. And those results are really, really tremendous. They're captured in our results report. And there will be more coming out because we are doing a lot of assessment around these countries. This investment, which has now grown to 130 million, from 10 million in 2017 to 130 million in 2022, is really, actually 2023, is a significant investment in promoting and protecting human rights by the Global Fund. On to COVID, and I very briefly want to mention COVID. We usually haven't reported a lot on COVID, but this year, of course, we needed to. We commissioned a small study by Imperial College London, who looked at our initial investment, and we are talking about 405 million US dollars investment delivered between May 2020 and November 2022. And these are some of the outcomes that we saw in that study. Basically, we enabled 49.6 million symptomatic people in communities to access RDTs, 65.4 million healthcare worker days, protecting 65.4 million healthcare worker days by providing health workers with adequate PPE. There'll be a few other numbers like this in this report that will show the progress that we made there by investing in COVID. More importantly, this is what I wanted to emphasize. After the initial response, what we are doing now at the Global Fund is to reinvest that the C19RM money in health systems, basically to accelerate our investments there, build pandemic preparedness. And I wanted to share this example of our investment in, in labs. And what you can see there is the 2017-2019 investment, 44 million. That's what we had invested in core grants that went to the labs. And basically, when we reprogrammed, and of course, there has been an intentional increase in investment in the lab systems, even in the core grants, which rose to 110 million or have risen to 110 million between 2020 and 2023. And then that rapidly accelerates. And on top of that, now you have 144 million from the COVID-19 response mechanism, basically moving from 44 to 254 million investment in lab system through reprogramming of COVID C19RM investments. To end is to say that, of course, we are at a time when we are off track because of many factors beyond COVID. We are talking about issues like climate change, conflicts, erosion of human rights. And these are crises that we need to tackle if we are going to get back on track. The challenging operating environments, there is now what is being referred to as the Sahel Spring, basically all these coups across the Sahel, which of course is going to increase conflict and affect programs. Climate change, we've seen impact in areas in countries like Mozambique with floods, Somalia with droughts, Pakistan with floods. And these are issues that are going to affect the work we do, affect the impact we make, and we are going to have to be very smart in how we invest to conquer these challenges. In a nutshell, the Global Fund has disbursed, this report will show, up to more than 60 billion to respond to HIV, TB, and malaria across 120 countries since 2002. 2022 was another record year, disbursed up to $5.2 billion. That is how our investments are distributed. Of course, Sub-Saharan Africa taking the largest share of the cake, 72%. And that is how we are investing. That is how, that's the share of our international grants. International grants, it's good to emphasize that because, of course, this doesn't factor in what countries are investing. This is what, if you talk PMI, PEPFAR, all that, this is the share of Global Fund contribution. When you measure multilateral, bilateral investments, 28% in HIV, 76% investment in TB, and 65% in malaria. And basically, that brings me to the end of my presentation.
Thanks a lot, Ernest. Sorry, I was jumping in to say that it would be good to have a bit of time for questions. Thanks a lot for this really good presentation and really informative. I noticed we had a few questions in the chat that have been posted while you were talking. So I would encourage you or colleagues from the Secretariat to look at them. But just I want to flag in particular, and then if anyone with questions can raise their hand or put them in the chat. So Robin, I see your hand up. While people raise their hands, I would just want to quickly cover some of the questions that have been raised in the chat. In particular, whether there was investment on the 4-month new TB regimen by the Global Fund, whether the treatment statistics for HIV were for Global Fund programs only or included in particular the PEPFAR programs. So whether that was the 24 million figure was inclusive of a 20 million figure coming from PEPFAR. And whether we whether considering the rise in infection over 2020 and 2021 in TB, we should expect the decrease in numbers to continue in the coming years. And finally, whether the projections in terms of impact for malaria accounted for new innovative tools, or only taking into account current tools. These are all the
Sorry,
questions.
I'm not keeping up very well. Can we take three? Sorry, and I'll start addressing one. The one about this number here. Just a minute, sorry. The 24.5 million these are in countries where the Global Fund invests. And basically, this is what has come from the programs that the Global Fund supports. But there's a caveat here. What the Global Fund did, or what this report did, we basically do not attribute, we report contributed. So in a country where the Global Fund and PEPFAR are investing, we count those together. So basically that we include PEPFAR and Global Fund, but there's a lot of interaction between the two. There's a lot of, in some cases, for instance, let me give you an example. In some cases, the Global Fund will invest in the clinic where the treatment is offered, and PEPFAR will offer treatment for the people. So in such case, you cannot count one and leave the other. So basically, it includes both. If that is clear. Sorry, I missed a few other questions. I want to ask you to take three.
Yeah, no problem. Sorry, I'm gonna just take I want two more questions to be covered, and then I'll move on to Robin, who has raised their hand. So the first one was regarding the 4-month TB regimens of rifampicin and moxifloxacin. Is the Global Fund investing in that new regimen for TB? So that's
Yes.
the first question. Yeah. Okay.
Sorry.
Wonderful.
Go ahead.
sorry, but go ahead.
Yes, we are. And immediately WHO came up with the new provision for that. The Global Fund put out a communication saying, of course, countries can request for that. So yes, countries are requesting, and the Global Fund support. I don't know exactly how much of that for GC7, but the numbers would show that yes, we are investing in that.
Wonderful. And regarding the impact, the TB statistics, since we saw a rise in infection during COVID, can we expect the lowering in the number of deaths currently to keep going, or are we expecting to see a spike as a side effect of that increase in infection during 2020 and 2021?
We don't know yet. The report, the global TB report will come in a few weeks, as I mentioned earlier. But it's very likely that we haven't still recovered. As you saw last year, there was an increase in number of deaths that were reported by WHO. To the extent to which we recovered that in 2022, we don't know yet. If I were to guess, I would say, given this acceleration that we are seeing in our programmatic results, it's very likely that we will begin to see a drop in those deaths, but we don't know yet. We can only speculate.
Thanks. And I want to turn to the room. Robin, do you want to ask a question?
Thanks, Conte. And thanks, Ernest. This has been a terrific, very comprehensive overview of a large report. So thank you so much for this detail. Just off the top, I think just a huge round of applause for all of us in terms of the progress made. It's really, really impressive. So thank you for really showcasing that so well. I have two questions, Ernest. The first one is, let me just pull up my questions here. So I'm interested, these are kind of linked questions. The first question is, if you can tell us a little bit more about how the report is being framed in terms of its narrative behind this impressive progress. So are there key messages that are going to be in the executive summary, for example, that can be easily pulled that talk to what are the drivers of this progress? That's the first question. And then the thing that I missed in the presentation, and hopefully it's really well fleshed out in the report itself, is really the role of community-led responses in civil society, advocacy, and programming and services on the ground. So I saw it within the RSSH story, but it wasn't necessarily added to the discussions around new innovative tools. So I didn't see, community-led program innovations being listed there. And for investing in impact, I saw monetary investments, but I didn't see the investments that are made by communities and civil society, including, their ideas, their time, their contributions, and so on and so forth. And then my last question, which relates to the first in terms of what is the narrative, how is this being framed, is to hear a little bit about what the plans are to break down this report so that it can help to influence discussions and the commitments that come out of the SDG Summit, and more particularly the 3 HLMs. So for example, will there be a focus on what the drivers of this transformational change have been from the perspective of the Global Fund Partnership? Thanks so much.
Thank you. I think I'll take that one first. Basically, the narrative. The narrative, if you are to think about these reports in terms of narrative, 3 messages. First, rapid recoveries and acceleration post-COVID. Basically, our partnership has really delivered, in the last 3 years, accelerated progress. The second point is, despite that progress that we see, we are still way off track. As you saw those SDG graphs, we are way off track. Even as we accelerated, we remain way off track. And the third point then becomes, what can we do to get on track? We know how to do it, and that's what we showed in the last 3 years. And yes, you're right. It's not just money. It's equity, as I had mentioned earlier. It's communities being at the center. And the report will tackle quite a bit of that, as I know you asked about community-led. I'm very eager to hear if it's not enough. We want to continue to improve, and we'll take on that challenge. In fact, your point about investing for impact, this is another chapter that we need to really improve on in this report, the way we do it. We would want to find a way to account for that contribution in terms of investment by communities. We haven't done it very well, I admit. We have quite a few numbers of where we have put money. We would need, to really accept, do better in that. And that's really good feedback for us. Thank you.
I don't see any other hands up. There was a few questions in the chat that I would ask for from the Secretariat to perhaps answer directly in the chat, because we're running a bit out of time, and I do want to have a second to cover some of our advocacy for next week. So I really want to thank you, Ernest, for a really instructive and extensive presentation. It was really dense and really useful. We'll be really looking forward to the full report and trying to amplify those messages as the report comes out. And with this, I want to move towards GFAN's advocacy for UNGA. I'm just going to share my screen real quick.
Yes, let me move mine.
It's okay. I'll kick you out. There we go.
Thank you.
So thanks again a lot, Ernest. So very quickly, so that I don't get anyone late on there. I'm sure many of the next calls. So we've had a number of internal and external discussions with GFAN over the past year about what to do about the missed target of 18 billion for the 7th replenishment. And considering the global context and this, echoes we get from key donor countries, we have decided to focus not on topping up and trying to reach the target in this, outside of before the eighth replenishment, but focus for now on thanking donors for their contribution as to ensure, as to secure a strong eighth replenishment. We're going to focus on topping up for the seventh. So we'll launch a campaign during the United Nations General Assembly week. So that's next week. We have an open letter titled one year letter thank you. You have a link for that open letter and opportunities to sign on in the chat. We'll launch a social media campaign on September 21st, which will be the 1 year anniversary of the seventh replenishment. And we'll send emails directly to top donors to share that open letter, a personalized version of that open letter to each of them, to try to get across the message that we might have missed the target, but it was the largest replenishment to date, and it has saved many lives, as the results report shows. So I will be sharing more information on these efforts on the listserv. This is an example of some of the visuals that we'll be pushing during Anga Week. I think we're at the hour and we ran out of time. I really want to thank everyone for joining today and for taking the time, and I want to thank in particular the team from the Secretariat for their really useful presentation. We're looking forward to the communication toolkit, the presentation, and the key messages, and we'll see you all very soon, either in New York or on the next call after that. Thanks, everyone, and have a good, good rest of your morning, afternoon, evening, night for some of us.
Thanks, everybody. Thanks, Ernest.
See you in New York.
See you in New York.
Bye. See you in New York.
See you in New York.
Bye-bye.
Bye, everyone.
Take care.
Bye. See you, Quintin, in New York.
Hey, Quentin, this is Mark. See my email. We should see each other next week.
Looking forward to it. All right.